Hi, so we did our topic on abortions in America. So to get started with our introduction, abortion is a very controversial subject that leads to a division between pro-life and pro-choice. With the overturning of Roe v. Wade, there has been an opportunity open for women to speak for themselves in the rights of their bodies.
Mhm.
Roe v. Wade was the decision of the Supreme Court in which the court ruled that the Constitution protected the right to have an abortion. One of the biggest questions is if abortion is ethically right and when and if abortion should be performed. No one has the same situation, and not everyone can make the decision to have a child at that moment. And to get into pro life versus pro life is about having the value and equality of all humans. People who are pro life are normally against abortions because they believe, even as an embryo, that baby is still a human being and it is still considered taking their life. The definition of pro life is taking the life of a preborn baby is a violation of the fundamental right to life. Pro choice is when people believe every human has the right to decide if they want a baby. The definition is denying a woman an abortion is denying her the right to bodily autonomy. Ethics would be, is the abortion right, is a right or wrong thing to do? That's a lot of question. That's a big question that people have on this topic. Many people believe it is their body, their choice, and many people believe that abortion is murder, no matter what the situation is. These beliefs can go back to people's religions and personal beliefs, and also how they were raised.
So the next thing we're going to discuss is the different types of abortion. There are three different types of abortion. There's vacuum, dilation and curettage, and medication. Each abortion has its pros and cons, and some methods are preferred over others due to their phase far along the mother is gestation. So the first type is the vacuum aspiration. Vacuum aspiration is usually done in the first trimester up to 20 weeks at the most. It's done in a clinical setting such as the clinic or Planned Parenthood, and it can be done under local or general anesthesia. A vacuolette is inserted into the uterus that is connected to a suction machine. The tube is inserted into the amniotic sac and is then turned on to suction things out of the uterus. Afterwards, the contents are examined to make sure that everything has been collected. If not all contents are collected, the curette can be taken to scrape the endometrium, and the endometrium is in the inside of the uterus. This method is preferred because of how little the cervix has to be dilated and the minimal side effects that it has on the mother. The next one is D&C, otherwise known as dilation and curettage. This is not as common as the vacuum due to the invasiveness and pain associated. This is done in a clinical setting such as a gynecologist office or Planned Parenthood. This is usually done between 13 to 22 weeks gestation. What happens is a tool medication dilates your cervix, and a curette is used to remove the uterine contents by scraping out the inside of the uterus. The cons of this is that there is major bleeding and high infection risks associated. However, this is more commonly performed after a miscarriage to ensure all contents were passed.
For medication abortion, this is the least invasive method. So this can be done at your home, or in a Planned Parenthood place. It can be used up until the 11th week of pregnancy, and it's used to continue the development of a fetus in the early stages of pregnancy. So there's a cutoff at 11 weeks. There are two hormone pills two pills that they provide to you for that. One is mifepristone that blocks the essential pregnancy hormone, which is progesterone. And then the second pill that a woman would take is a misoprostol pill that within the uterine lining so that the pregnancy can no longer stay in the uterus. And the effectiveness, 8 weeks or less, there's a 94 to 98% effectiveness rate. And with 10 to 11, it lowers a little bit more with an effective rate of 87%. But if you take an extra dose of the misoprostol pill, it'll bring the effectiveness up to 98%.
Okay, so there are 3 stages of fetal development. So the first one is the zygote stage, and it happens during week 1 and 2 of fetal development, and it does not possess any characteristics that would define a human being. And then the second stage is the embryonic stage, and this happens during week 3 through week 8, and it is crucial for major structures and organs. Also, many ethical decisions begin at this stage and focus on potential for life and whether an embryo should have rights based on the developmental capabilities. And then the third stage is the fetal stage. This happens during week 9 through week 40. It's significant for growth and development. More ethical implications are pronounced as the fetus develops the capacity to experience pain and awareness. When abortions are discussed during this stage, it often involves the moral considerations of suffering and the potential for a meaningful life. And then to talk about fetus rights and medical advancements. So some argue for fetal rights based on biological criteria or certain rights like the capacity for consciousness and pain. And then others argue that fetal rights are based on traits that fetuses don't possess until later in gestation, and it is up to the woman who is carrying the fetus. And then medical advancements could be made with aborted fetuses. This could include tissues, could be used in vaccine development and regeneration medicine. And then to talk about or to conclude it all, the topic of abortion remains one of the most present issues in contemporary society. The fetal development, which has introduced multiple ethical considerations. And then ethical questions surrounding abortions are not easily answered because they depend on personal beliefs and societal norms. And I think that's all.
These are our references. And
Oh,
Slay.
sorry, I had to figure out how to stop the recording.